The latest findings of the Global Cocaine Report shows how the global market of cocaine is rapidly increasing, with 35% increase in cocaine production. This really makes it the record high supply global of cocaine. We are talking about a market that is really global. So I'm Angela Mer. I'm the head of research at the UN Office on Drugs and Crime, and I'm the one that oversaw the production of the first global report on cocaine, where we put together all the global data and information available on the supply and demand of cocaine. What really surprised me from the findings of the report is the fast expansion of the cocaine market globally. Now we see actually that we are in the cycle where demand calls supply and supply increase demand. And we see increased demand in Europe, and we see sign of cocaine reaching what we call emerging markets. So markets where before really didn't know much about cocaine, particularly Africa, Asia, and Eastern Europe, where a very small increase in the percentage of cocaine use could translate in millions or more cocaine users around the world. And this is coupled with also increase in cocaine use in Europe, and also the change in some of the trafficking hubs. And so, for example, an increase in trafficking of cocaine from Latin America to Europe through Western, Central, and North Africa. We starting seeing now the emergence of people going to treatment in Africa for cocaine. So as a sign that now it's not just a transit country, but the cocaine is also staying in Africa, so starting, in a way, a new market. So in a way, the world is having a record high supply of cocaine. When we study a market, we triangulate data to understand how the market goes. And mainly we triangulate purity, price, and then production and use. And so we see it together. And what we've been seeing happening in Europe is that these indicators started to align with what we had in the US. And consumption started to increase. But there remains a lot of factors that are behind drug use. And there are factors of marginalization, factors of social and economic condition that we see, particularly with COVID, how much this have also affected the population. And so these are all factors. We see also how technology is helping traffickers to conceal, to hide the cocaine. Before, particularly in Colombia, you would have farmers growing coca leaf, and then somebody else would make it as a base, and then from the base you do the cocaine. And now you see really everything concentrated, so that is very efficient. In that sense, is the business efficiency that the groups have been able to establish. Yeah, it's remarkable. In UNODC, particularly, we support countries to address the problem of drugs from the research, from the data, so to build the evidence that is able to understand what are the dynamics and the problem, to helping countries from the health side, so to develop prevention and treatment services that are based on evidence, again based on research on what works and what does not work, so to implement only those that we know they work, and then from protecting borders. So we have large programs that help countries to control containers, so control ports, so the containers that come to ports, and how to scan them and how to see where to find drugs and other illegal commodity, but also helping from the criminal justice response, so to support countries, again, in implementing criminal justice response that protect the victims, that do not treat drug users as criminals, but that a criminal justice system that is tough with the traffickers that make the highest profit. What we need to solve the organized crime problem is working with the communities to understand what are the vulnerabilities of communities in terms of development, education, rule of law that can protect community. So to start by looking at drug use really from a health perspective. First of all, support the prevention, and then once we have people that become dependent on drugs, to apply evidence-based treatment, and also with the respect, the dignity of all patients' need. And trying to find alternatives to those that, even if they are involved in small-scale offenses, are more the victims, really, than the perpetrators. So to treat drug use not as a crime, and to treat drug users as patients, we say, and not as criminals, particularly of those that are more vulnerable, the young people, that are more vulnerable to become dependent to the drug.